Welcome back, everyone, to The Deep Dive. Today,
Mhm.
we're going deep on a topic that I think is going to resonate with a lot of you. We're talking about acne.
Yeah, acne.
And to help us out with this, we've got a great collection of information from some really reputable sources. We've got stuff here from the American Academy of Dermatology,
Cleveland Clinic.
Harvard Health.
And Nemours KidsHealth.
And, it's interesting because one of the things that kind of jumped out at me when I was looking at all this material was that this isn't just a teenager problem.
Right.
This is something that adults deal with as well.
Yeah, a lot of adults have acne. It's really common.
So we've got a lot of information here, and it kind of runs the gamut from like really practical advice
Hmm.
to a little bit more of a deeper explanation of the biology behind it.
Yeah.
So our mission today is to synthesize all this for you, give you a clear picture of acne,
Yeah.
what causes it, how to manage it, and importantly, when to seek professional help.
Right.
So you don't feel overwhelmed. You feel empowered to deal with this.
Absolutely.
Okay, so let's just jump right in. First of all, what is acne?
Okay, so acne is a skin condition,
Hmm.
super common. It causes pimples because your pores get clogged.
Okay.
The medical term is acne vulgaris.
Acne vulgaris.
But yeah, basically it's just when your pores get blocked and then stuff can't get out.
Yeah, and it's not just on your face either, right? I mean, I've certainly had experience with it
Oh
on
yeah,
other parts of my body.
definitely. So it's most common on your face,
Okay.
forehead, but you can get it on your chest, your shoulders, and your upper back.
Okay.
And that's because that's where you have the most oil glands.
That makes sense.
Yeah, those sebaceous glands are producing oil all the time, and that's what leads to the acne.
And there are different types of acne too, right?
Yes, definitely.
Like I've heard people talk about cystic acne.
Right. So cystic acne is when you get those really deep pimples that are filled with pus.
Ugh.
Yeah, they're not fun. And they can scar, too.
Oh no.
So that's one type. Then there's fungal acne.
Fungal acne. What's that?
That's actually caused by yeast. So it's not bacteria like regular acne. It's a buildup of yeast in the hair follicles. And it can be really itchy and inflamed.
Oh, so many different kinds.
Yeah, and then there's hormonal acne, which is common in adults.
Okay.
That's usually linked to, hormonal changes
Okay.
and overproduction of sebum. And then there's nodular acne, which is a more severe form. It's where you have pimples on the surface of your skin, but then you also have these tender lumps underneath.
So you've got the pimples, and then even deeper down, there's more going on.
Exactly.
That sounds rough.
Yeah, it can be pretty painful.
So obviously, any type of acne can affect someone's self-esteem,
Right.
especially when we're talking about things like cystic acne and nodular acne, because those can actually lead to scarring.
Absolutely.
So it's really important to treat acne early and effectively.
Right. If you can prevent those scars from forming in the first place, that's the best case scenario.
Yeah, for sure. Okay, so who is most likely to get acne? Is it mostly a teenager thing?
Well, it is super common in teenagers and young adults.
I have.
In fact, about 80% of people between the ages of 11 and 30 have at least a mild form of acne at some point.
Wow, that's a lot of people.
Yeah, but, adult acne is also very common, especially among women.
Okay, so it's not just a teenager thing.
Definitely not.
And our genetics play a role?
Yeah, there is a genetic component to it. So if your parents had acne, you're more likely to have it too.
Okay, so let's talk about the different types of blemishes. I mean, there's obviously pimples,
Right.
which I think everyone knows what a pimple is.
Pimples are also called pustules. Those are the ones with the pus in them.
Right. Okay. What else?
There's papules, which are small red bumps. They can be purple or even darker than your skin tone.
Okay.
And then there's blackheads.
Blackheads. I think I know what those are, but what causes that black color?
So a blackhead is basically a clogged pore. It's filled with oil and dead skin cells. And the surface of it oxidizes, which means it reacts with oxygen in the air, and that's what turns it black.
Oh, so it's like rust.
Kind of, yeah.
Interesting.
And then you have whiteheads, which are also clogged pores, but the top of the pore is closed, so it looks white or kind of flesh-colored.
Okay.
And then there are the more severe types of blemishes. Nodules, which are large, painful lumps under the skin, and cysts, which are also painful lumps, but they're filled with fluid.
Okay. So we've got this whole spectrum of blemishes from like kind of minor annoyances
Right.
to things that can be pretty painful and serious.
Yeah.
So what's actually going on in our skin to cause these blemishes to form?
So the main culprit is clogged pores or hair follicles. It's the same thing.
Okay.
And there are a few different factors that can contribute to this clogging. One is sebum.
A sebum.
That's the oil that your skin produces naturally to keep it moisturized.
Right.
But if you produce too much sebum, it can clog your pores. And things like hormonal changes, stress, and even your menstrual cycle can affect how much sebum your skin produces.
Okay, so hormones are playing a role.
Definitely. And then there's bacteria.
Bacteria.
We all have bacteria on our
Yeah.
skin. Okay. It's normal. But sometimes these bacteria can get trapped inside a clogged pore and they start to multiply. And that can lead to inflammation.
Okay, so the bacteria are kind of trapped in there and they're multiplying.
Yeah. And then you've got dead skin cells.
Right.
Normally our skin cells shed naturally. But sometimes they don't shed properly and they can get stuck in the pores and contribute to the clogging.
So it's kind of like a combination of everything.
Yeah, it's like a perfect storm. The sebum, the bacteria, the dead skin cells. And then all of this triggers inflammation, which is your body's natural response to anything that's irritating it.
Right.
And that's what causes the redness, the swelling, the pain.
So it's like a chain reaction.
Exactly.
Okay, so we know what causes acne. Now, are there things that can make it worse or trigger breakouts?
Oh, yeah, absolutely. Lots of things.
Like what?
Well, for one, tight clothing.
Okay.
Or anything that rubs against your skin a lot,
Why?
like hats or headbands.
Right.
Because that can trap sweat and oil against your skin.
Okay, that makes sense.
And then air pollution and high humidity can also make acne worse.
Really?
Yeah, because the pollution can irritate your skin and the humidity makes you sweat more.
So if you're in a really polluted city,
Mm-hmm.
you might be more likely to have breakouts.
Yeah, and then there's using oily or greasy skincare products,
Okay.
like heavy makeup or thick lotions. Even oily hair products can drip down onto your face and clog your pores.
Oh, I hadn't thought about that.
And if you work in a job where you're exposed to grease a lot, like in a restaurant kitchen,
Okay.
that can also be a trigger.
Interesting.
And then there's stress,
Ah, yes.
everyone's favorite.
Right.
Stress can raise your cortisol levels, which is a hormone, and that can make your skin produce more oil.
Okay. So stress can actually lead to more breakouts.
Yeah, and then there are certain medications that can cause acne as a side effect, like corticosteroids, anabolic steroids, and lithium.
Okay, so if you're on any kind of medication, it's always a good idea to talk to your doctor about the potential side effects.
Exactly. And then one of the biggest things that can make acne worse is picking at it.
Oh, yeah.
I know it's tempting, but when you pick at your acne, you're actually introducing more bacteria into the area and you're causing more inflammation.
Okay.
And that can lead to scarring and those dark spots that can linger even after the pimple is gone.
Oh, those are the worst.
Yeah, they're called post-inflammatory hyperpigmentation. And they can be really hard to get rid of.
So as tempting as it is to pick, leave those pimples alone.
Exactly. Let them heal on their own.
Okay, so we've talked about a lot of things that can make acne worse. What about diet?
Mm.
Does what we eat affect our skin?
That's a really good question, and it's something that a lot of people wonder about, and the research is still kind of evolving on this.
Okay.
But some studies have shown a link between dairy products and
Yeah.
acne.
Really?
Yeah, particularly skim milk and whey protein.
Interesting.
And there's also some evidence that eating a lot of high glycemic index foods,
Which are?
which are foods that cause your blood sugar to spike really quickly, like sugary drinks and processed foods. There's some evidence that those might contribute to acne as well.
Okay.
But, it's important to note that the research on diet and acne is still ongoing, and there's a lot of misinformation out there. So
Right.
you have to be careful about what you believe.
So what's the bottom line? What should people eat if they want to have clear skin?
Well, a healthy, balanced diet is always a good idea. But in terms of acne specifically, some experts recommend focusing on foods that are rich in antioxidants and anti-inflammatory compounds.
What kinds of foods?
Fruits and vegetables,
Mm-hmm.
whole grains, lean protein, healthy fats, things like that.
So kind of a Mediterranean-style diet.
Yeah, exactly. And some people find that cutting back on dairy and sugar helps their skin.
Okay.
But it's really a matter of experimenting and seeing what works for you.
All right, so we've got to pay attention to our diet, but it's not necessarily a magic bullet.
Right.
You mentioned hormones earlier. Can you talk a little bit more about the role of hormones in acne?
Sure. So hormones, especially androgen hormones like testosterone, play a big role in acne development.
Okay.
Androgens stimulate the sebaceous glands to produce more oil.
Right.
And that's why acne is so common during puberty.
Because our hormones are going crazy.
Exactly. And for women, hormonal fluctuations during the menstrual cycle can also trigger breakouts.
Okay.
So basically, hormones, oil glands, bacteria, all of these things kind of work together to create the perfect environment for acne to develop.
Wow, it's complicated.
It is.
So we've talked about teenage acne. What about adult acne? Is it any different?
Well, the underlying causes are the same: excess oil, clogged pores, bacteria, inflammation.
Okay.
But adult acne often has some unique characteristics.
Like what?
Well, for one, it tends to develop later in life, usually after the age of 25,
Okay.
and the blemishes might be different.
Different how?
Adults are more likely to get inflammatory lesions, those are the red and painful ones, around the lower part of the face.
Okay.
And adult acne is often more closely linked to hormonal fluctuations. Right.
Especially in women.
So if you're an adult and you're suddenly breaking out, it could be a hormonal issue.
Yeah, it could be. It's definitely something to talk to your doctor about.
Okay, so we've got a pretty good understanding of what causes acne and what can make it worse. Now let's talk about what we can do about it.
Okay.
What are some of the at-home care tips that dermatologists recommend?
Well, the first and most important thing is to keep your skin clean.
There.
You should wash your face twice a day with a gentle cleanser.
Twice a day.
Yeah, once in the morning and once at night. And it's important to wash your face after you sweat,
Okay.
like after you exercise.
So if you work out in the morning, you should wash your face again, even though you already washed it.
Yeah, exactly.
Okay.
And use lukewarm water, not hot water.
Okay.
And when you're washing your face, be gentle.
Gentle.
Yeah, don't scrub hard.
Okay.
Just use your fingertips to gently massage the cleanser into your skin.
Okay.
And avoid harsh scrubs or washcloths.
Because that can irritate the skin.
Okay. And what kind of cleansers should we use?
You want to use a cleanser that's specifically designed for acne-prone skin,
Okay.
and look for one that's oil-free and non-comedogenic.
Non-comedogenic. What does that mean?
It means it won't clog your pores.
Oh, okay. That makes sense.
And you know, it's really important to choose your skincare products carefully.
Okay.
You want to avoid anything that's going to irritate your skin or dry it out too much.
Right.
So that means avoiding products that contain alcohol, astringents, toners, and harsh exfoliants.
Okay.
And make sure your sunscreen is non-comedogenic too.
Oh, yeah. Good point.
Because you want to protect your skin from the sun, but you don't want to clog your pores at the same time.
So basically, we should be looking for gentle, oil-free, non-comedogenic products.
Exactly.
Okay. Anything else?
Yeah, don't forget to shampoo your hair regularly.
Especially if it's oily.
Yes, especially if it's oily.
Okay.
Because the oil from your hair can transfer to your face and contribute to breakouts. And you know, one of the most important things is to be patient.
Patient.
Yeah, don't expect to see results overnight.
Okay.
It can take several weeks or even months for acne treatments to really work.
So we have to stick with it.
Yeah, you have to be consistent.
Okay.
And don't keep switching products all the time.
Right.
Because that can actually irritate your skin and make things worse.
Okay, so find a routine that works for you and
Yeah.
stick with it.
Exactly.
Okay, so we've talked about keeping our skin clean and choosing the right products. What are some other things we should avoid doing?
Well, the biggest one is don't pick at your acne.
I know you said that before, but it bears repeating.
It does, because it's so tempting to do.
It is.
But it really can make things worse.
Okay.
And another thing to avoid is excessive sun exposure.
Right.
I know a lot of people think that tanning can help clear up acne,
Okay.
but it's actually not true.
Really?
Yeah, sun exposure can damage your skin and make your acne worse, and some acne medications can make your skin more sensitive to the sun.
Okay.
So you have to be really careful about sun protection.
So no tanning beds.
Definitely no tanning beds.
Okay.
And when you're out in the sun, wear protective clothing, like a hat and sunglasses.
Okay.
And use sunscreen with an SPF of 30 or higher.
Every day.
Every day.
Okay. You mentioned DIY acne treatments.
Yeah.
Are there any at-home remedies that actually work?
Well, a lot of the things we've already talked about are DIY treatments.
Okay.
Like washing your face twice a day with a gentle cleanser.
Right.
And using oil-free, non-comedogenic products.
Okay.
And removing your makeup before you go to bed.
Right.
And not picking at your acne.
Okay.
Those are all things you can do at home to manage your acne.
Right.
And the most important thing is to be consistent with your routine and to avoid anything that's going to irritate your skin.
Okay.
So no harsh scrubs or abrasive products.
Okay.
Just gentle cleansing and moisturizing.
Okay. What about over-the-counter acne treatments? Do those work?
Yes, they can be very effective for mild to moderate acne.
Okay.
There are two main ingredients to look for in over-the-counter acne treatments:
Okay.
benzoyl peroxide and salicylic acid.
Benzoyl peroxide and salicylic acid.
Right.
What do those do?
So benzoyl peroxide kills the bacteria that cause acne,
Okay.
and salicylic acid helps to unclog pores and reduce inflammation.
Okay.
So they work in different ways, but they can both be very effective.
So how do you know which one to use?
It really depends on your individual skin type and the severity of your acne.
Okay.
It might take some trial and error to find the right product for you,
Okay.
but if you're not sure, you can always ask a dermatologist for recommendations.
Okay. So when should you see a dermatologist?
Well, if your acne is severe,
Okay.
or if it's not responding to over-the-counter treatments,
Okay.
or if you're worried about scarring,
Okay.
or if you have any other concerns about your skin.
Like what?
Well, if you have sudden severe acne as an adult, that's something you should definitely get checked out
Okay.
because it could be a sign of an underlying medical condition.
Oh, wow.
Yeah. And if you're experiencing other symptoms along with your acne,
Like what kind of symptoms?
things like hair loss, excess hair growth, irregular periods, rapid weight changes,
Yeah.
those could be signs of a hormonal imbalance.
Okay.
And if your current acne treatment is causing a lot of irritation,
Okay.
that's also a sign that you should see a dermatologist.
Okay. So if you're having any kind of unusual symptoms or if your acne is just not getting better,
Yeah,
you should definitely see a dermatologist.
exactly.
Okay. What kind of treatments can a dermatologist offer?
Well, they can prescribe stronger medications than you can get over the counter,
Okay.
like topical retinoids, antibiotics, azelaic acid, dapsone.
Wow, that's a lot of options.
Yeah, and if your acne is more severe, they can prescribe oral medications,
Okay.
like antibiotics, isotretinoin, or hormonal therapies like spironolactone.
Okay. And what is isotretinoin?
Isotretinoin is a very powerful drug that's used for severe nodular acne.
Right.
It can be very effective, but it also has some potential side effects. So
Okay.
it's important to talk to your doctor about the risks and benefits before you start taking it.
And spironolactone.
Spironolactone is a medication that's often used to treat hormonal acne in women.
Okay.
It blocks the effects of androgens on the skin.
Okay. So it's basically a hormone blocker.
Right.
Okay. And what about in-office procedures? Can dermatologists do those?
Yeah, they can do a lot of different procedures in their office.
Like what?
Well, they can inject large nodules with corticosteroids to reduce inflammation.
Okay.
They can use lasers and light therapy to target acne bacteria and reduce inflammation.
Okay.
They can do chemical peels to exfoliate the skin and improve active acne and post-inflammatory hyperpigmentation.
Okay.
And they can do photodynamic therapy.
Photodynamic therapy, what's that?
It's a treatment that uses light and a special medication to kill acne bacteria.
Okay. So there's a lot of different things that a dermatologist can do to treat acne.
Yeah, they have a lot of tools in their toolbox.
Okay. So why is it so important to see a dermatologist for acne?
Well, a dermatologist is a skin specialist.
Right.
They have the knowledge and experience to diagnose your acne accurately
Okay.
and to determine the best course of treatment for you.
Cool.
They can also help you to prevent scarring and to manage any side effects from your medications.
Okay. So it's really worth it to see a dermatologist if you're struggling with acne.
Yeah, definitely.
What about acne treatment during pregnancy? Are there any special considerations?
Yes, absolutely.
Okay.
Many acne medications are not safe to use during pregnancy.
Really?
Yeah, because they can harm the developing fetus.
Okay.
So if you're pregnant or breastfeeding or if you're planning to become pregnant, it's really important to talk to your doctor about your acne treatment options.
Okay. So no self-treating if you're pregnant.
Definitely not.
Okay. So how long does it usually take for acne to clear up once you start treatment?
Well, individual pimples can take 1 to 2 weeks to heal on their own,
Okay.
but with treatment, you can often see improvement in your overall acne within a few weeks.
Okay.
But it can take several weeks or even months for your acne to completely clear up.
So we have to be patient.
Yes, patience is key.
Okay.
And consistency is important too.
Okay.
You have to stick with your treatment plan even if you don't see results right away.
Okay. So is there any way to prevent acne from happening in the first place?
Well, you can't always prevent acne completely,
Okay.
especially if it's hormonal.
Right.
But there are definitely things you can do to reduce your risk.
Like what?
Well, washing your face twice a day with a gentle cleanser,
Right.
using an oil-free moisturizer,
Okay.
choosing non-comedogenic makeup,
Right.
removing your makeup before you go to bed,
Okay.
and not touching your face too much.
Okay.
Those are all good habits to get into.
So basically good skin hygiene.
Exactly.
Okay. We've talked a lot about the physical aspects of acne, but we also need to talk about the emotional impact
Right?
because acne can be really tough on people's self-esteem,
Absolutely.
especially for teenagers and young adults.
It can be really hard to feel confident when you're dealing with acne.
Yeah.
It can make you feel self-conscious, anxious, embarrassed,
Right.
and it can even lead to social isolation.
Yeah. So what can people do if they're struggling with the emotional impact of acne?
Well, it's important to remember that you're not alone.
Okay.
A lot of people experience acne,
Right.
and it's nothing to be ashamed of.
Okay.
It's also important to talk to someone about how you're feeling,
Okay.
whether it's a friend, a family member, a therapist, or a dermatologist.
Right.
Just getting those feelings out in the open can really help.
Yeah, for sure. And what about acne scars? Can those be treated?
Yes, they can be treated.
Okay.
There are a lot of different treatment options available depending on the type and severity of your scars, like topical treatments, chemical peels, microneedling, laser treatments, and fillers.
Okay. So if you have acne scars, there's hope.
Yes, definitely.
Okay. So let's say someone is going to see a doctor about their acne. What questions should they ask?
That's a great question. It's always good to be prepared.
Yeah.
So some questions you might want to ask your doctor are, what type of acne do I have? How severe is it? Do I need to see a dermatologist? What over-the-counter products do you recommend for my skin type? What prescription medications might be helpful? What are the potential side effects of those medications? And how long will it take to see results?
That's a great list of questions.
Yeah, I think those are some good starting points.
Okay. So we've covered a lot of ground today. What are the key takeaways?
Well, I think the most important thing is to remember that managing acne is a journey.
Okay.
It takes time, patience, and experimentation to find what works for you.
Okay.
But with the right information and the right treatment plan, you can achieve clear skin.
That's encouraging.
Yeah, definitely.
So pay attention to your skin, be patient, and don't be afraid to seek professional help if you need it.
Absolutely.
Okay. So for our final provocative thought, I think it's interesting to consider how understanding the underlying causes of acne can help us to shift our perspective.
Okay.
Because instead of just focusing on treating breakouts,
Right.
we could start to think about taking a more holistic approach to our skin health and overall self-care.
Yeah, that's a really good point.
So I would encourage all of you to think about the connections between your internal state and your external appearance.
Hmm.
Like, how does stress affect your skin?
Right.
How does your diet affect your skin?
Right.
How do your hormones affect your skin?
Yeah.
And what can you do to support your overall health and well-being?
It's all connected.
It is. All right, that's it for our deep dive on acne. Thanks for joining us.
Thanks for having me.
We'll be back soon with another episode.
Looking forward to it.
See you then.